500 plus million people have it. Most don't even know. So what is diabetes? What causes it? Who's at risk? And what are the warning signs you shouldn't ignore? Watch this video till the end, because I'm going to answer all these questions and share 7 important things you need to know about diabetes. And make sure you stay till the end, because I'll be sharing some very important tips that will help you prevent and manage diabetes better. So let's get started. 500 million people have it. Most don't even know. Have you ever wondered who gets diabetes? What does it look like? How do you know if you have it? To understand diabetes, we need to look at our body's internal mechanisms. We all have cells in our body called beta cells. They produce a hormone called insulin, which allows sugar from our food, also called blood sugar, to enter our cells to be used as energy. So, whenever we eat food, especially carbohydrate-rich foods, our body breaks them down into sugar. That sugar goes into our bloodstream and then signals our pancreas, specifically those beta cells, to release insulin. Insulin acts like a key, opening up our cells to allow the sugar to go in and be used as energy. But what happens when our body doesn't have enough insulin or can't use it effectively? That's when we have diabetes. More specifically, we're talking about type 2 diabetes, because there's another type called type 1 diabetes, which is an autoimmune condition where the body's own immune system attacks the beta cells, destroying them and leaving the body unable to produce any insulin. Type 1 diabetes is much less common than type 2 diabetes, and usually it starts in childhood or adolescence. People with type 1 diabetes need to take insulin injections because their bodies can't produce any. On the other hand, type 2 diabetes is a chronic metabolic condition where the body either doesn't produce enough insulin or can't use it properly, leading to a buildup of sugar in the bloodstream. This happens because our cells become resistant to insulin, meaning the insulin that's released doesn't work as it should, and so the sugar can't get into the cells and be used as energy. Now, type 2 diabetes is the most common form of diabetes, accounting for about 90% of all cases. And unlike type 1 diabetes, it can often be prevented and managed through lifestyle changes. So let's talk about the causes. What causes type 2 diabetes? Well, as I mentioned before, it's mainly caused by 2 factors: insulin resistance and lifestyle. Let's start with insulin resistance. When our body becomes resistant to insulin, it's harder for sugar to enter our cells, and so it builds up in our bloodstream. But why does this happen? Well, it's not entirely clear, but it may have something to do with genetics, obesity, or not getting enough exercise. Now let's talk about lifestyle. Type 2 diabetes is strongly linked to lifestyle factors such as poor diet and physical inactivity. Let me explain. When we eat foods high in carbohydrates, especially processed carbohydrates like white bread and sugary drinks, our body breaks them down into sugar and releases insulin. Over time, though, if we keep eating these types of foods and don't get enough exercise, our cells become less responsive to insulin, and that's when problems start to arise. The sugar starts to build up in our bloodstream instead of going into our cells, and that's when we have diabetes. So basically, type 2 diabetes is like a snowball rolling down a hill. At first it's small, but as time goes on, it gets bigger and bigger, causing more and more damage. And the good news is that we can stop that snowball before it becomes a huge problem. We can do that by making changes to our lifestyle, such as eating a balanced diet and exercising regularly. Now, what are the symptoms of diabetes, and how do you know if you have it? The thing is, many people with type 2 diabetes don't know they have it, because it often doesn't show any symptoms in the early stages. But as the condition worsens, some common signs include frequent urination, excessive thirst, blurry vision, fatigue, and slow healing wounds. As the blood sugar levels rise, the kidneys have to work overtime to filter out the excess sugar, which can lead to frequent urination. This can also cause dehydration, leading to excessive thirst. Blurred vision can occur because high blood sugar levels can affect the eyes, specifically the lens's ability to focus. Fatigue can happen because the body is not able to use glucose, which is the primary source of energy efficiently, leading to tiredness. Slow healing wounds or cuts can happen because high blood sugar levels can impair the immune system and reduce blood flow to extremities, affecting wound healing. If you experience these symptoms, please see your doctor for a checkup. So now let's move on to diagnosis. How do doctors diagnose diabetes? Well, they use a few different tests to check blood sugar levels. The main test is called HbA1c, which measures the average blood sugar level over a period of 3 months. Another test is the fasting glucose test, which measures the amount of glucose in your blood after fasting for at least 8 hours. Doctors may also perform a random blood glucose test at any time to check for high blood sugar levels. Based on these test results, doctors can diagnose diabetes and recommend treatment options. For example, if your HbA1c level is 6.5 or higher on 2 separate tests, or if your fasting glucose level is 126 mg per dl or higher on 2 separate tests, or if your random blood glucose level is 200 mg per dl or higher, then you have diabetes. Now let's talk about treatment and management. Once you've been diagnosed with diabetes, your doctor may recommend a few things to help you manage the condition. First, they may recommend changes to your diet, such as eating more fruits and vegetables, whole grains, and lean proteins, while reducing saturated and trans fats, cholesterol, and added sugars. They may also recommend regular exercise, such as 30 minutes of moderate intensity exercise most days of the week. In addition to lifestyle changes, doctors may prescribe medication to help manage blood sugar levels, such as insulin, sulfonylureas, meglitinides, glitazones, alpha-glucosidase inhibitors, DPP-4 inhibitors, GLP-1 receptor agonists, and SGLT inhibitors. It's important to follow your doctor's advice and take your medication as prescribed to help control your blood sugar levels and prevent complications. There are also some complementary therapies that have shown promise in helping people with diabetes manage their condition. These include things like yoga, meditation, acupuncture, and massage therapy. While more research is needed to fully understand the benefits of these therapies, they may be worth trying in addition to traditional treatments. Let's now talk about prevention. What can you do to prevent diabetes? Well, the good news is that type 2 diabetes can often be prevented or delayed with lifestyle changes. As I mentioned earlier, eating a healthy diet and getting regular exercise are key to preventing diabetes. Here are some specific things you can do. Eat plenty of fruits, vegetables, and whole grains. These foods are rich in fiber, which can help regulate blood sugar levels. Choose lean protein sources such as fish, poultry, beans, and tofu. These options provide protein without the added saturated fat and cholesterol found in red meat and processed meats. limit saturated and trans fats, added sugars, and processed foods. These can all contribute to weight gain and insulin resistance. Get regular exercise. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Exercise can help improve insulin sensitivity and lower blood sugar levels. Another question I often get is, can diabetes be reversed? The short answer is yes, and the long answer is it depends. In some cases, people with type 2 diabetes have been able to reverse their condition by making significant changes to their diet and lifestyle, such as adopting a low-carb diet or intermittent fasting. However, it's important to note that reversing diabetes is not easy and requires a lot of discipline and commitment. Also, it's not possible to reverse type 1 diabetes because that's an autoimmune condition where the body's immune system has already destroyed the insulin-producing cells. But people with type 1 diabetes can still manage their condition through regular monitoring of blood sugar levels and insulin injections. Last but not least, what are the complications of diabetes? Diabetes can cause some serious complications if it's not properly managed. These complications can affect almost any part of the body, including the eyes, kidneys, nerves, heart, and blood vessels. For example, diabetes can cause diabetic retinopathy, which is a disease that damages the blood vessels in the retina, leading to vision loss. It can also cause diabetic nephropathy, which is a condition that causes the kidneys to lose the ability to filter waste and excess fluid from the body. Moreover, diabetes can lead to peripheral neuropathy, which is a type of nerve damage that occurs in the feet and legs, causing numbness, tingling, or pain. And perhaps most importantly, diabetes can increase the risk of cardiovascular disease, including heart disease and stroke. Managing your blood sugar levels and following your doctor's recommendations for treatment can help prevent these complications. All right, folks, that's all I have for you today. Hopefully, you learned a thing or two about diabetes. Remember, knowledge is power, and taking control of your health is one of the best things you can do for yourself. Don't wait another day to start making positive changes to your lifestyle. Subscribe to this channel for doctor-backed health tips delivered right to your inbox every week. Comment your experience or questions below. Check out the playlist, Doctor Recommended Health Tips here. Thanks for watching, and stay healthy, my friends.